Tonight, big changes coming to the Cleveland Clinic on how patients pay. Starting June 1st, clinic patients will have to pay their insurance copays up front before seeing a doctor for non-emergency visits.
Appointments may be canceled or rescheduled if a patient cannot pay, and that new policy is drawing controversy. New Yorker reports.
Ivanka Hall says Cleveland Clinic's new copay policy requiring patients to pay up front will directly affect some of Northeast Ohio's most vulnerable in the community.
We talk about, poor people not being able to get their care, but it's really an attack on middle class people because most of the time poor people are on Medicaid and covers their care. But for middle class individuals that are coming in or people who have private insurance and they're coming in and they have a copay, if they don't have the dollars, then they're not going to be able to be seen. And so that's a hard pill to swallow.
She's the executive director for Northeast Ohio Black Health Coalition, a nonprofit that advocates for communities of concern. The change does not apply to Medicaid patients or those receiving emergency care, inpatient surgeries, cancer treatments, or urgent care visits. However, if patients can't make their copay at the time of the visit, they'll be asked to reschedule. Cleveland Clinic is the only major hospital system in Northeast Ohio to do this, which doesn't sit right with Hall.
We should be taking away every barrier possible in order for people to receive care.
In a statement to 3 News, Cleveland Clinic says we remain committed to providing the highest quality for patients and understand that navigating health care coverage can be challenging. Collecting all patient financial responsibility for the care we provide, starting with copays, helps us ensure sustainable hospital operations and supports the seamless delivery of care.
We renowned ourselves as the world-class provider of health. And so, the last thing I would want to say is that, in a place where we look at ourselves as being the elite above everyone else, that we have really left people behind.
We checked. UH does not cancel or reschedule appointments if the copay is not paid ahead of time. At Metro Health, patients can ask to have their copay billed to insurance. As for Hall, she tells me that she's prepared to continue working with lawmakers on universal health care. Russ?
Okay, New Yorker in the newsroom. Thank you.